My name is Debbie Lynn Toomey from Tufts Medical Center. I'm the Injury Prevention Coordinator, and my role is doing outreach and education and advocacy out in the community. And mainly I focus on falls prevention and also violence. So this particular program, I've been doing it since September through the Quincy Public Library, and it's been a wonderful experience for me, and I hope the people who have been listening to it have been gaining some valuable information. So without further ado, I do want to introduce my guest today, Katie Kowalski, who is Beth Israel's Injury Prevention Coordinator. So last time when we had this program, she spoke on the topic of about the program Think First, and she shared so many wonderful information with us that there's still more to cover. So she's here to share with us more information about the program Think First and how we could reduce any type of injuries, fall prevention, so that we could live a more independent and quality life. So Katie, take it away.
Thanks, Debbie. Thank you so much for having me back. I'm really excited. It's wonderful to see everyone's faces. So as Debbie was saying, I am the Injury Prevention Coordinator at Beth Israel Deaconess Medical Center. And today what we're going to do is we're going to do a little refresher on the material that I covered 2 weeks ago. And then we're going to get into some exercise. So I'm going to be showing you some examples of exercise. I do not want you to follow along. Always consult your physician before you start an exercise program. So that's going to be super important. So I'm just going to share my slides with you, and then we'll watch a couple videos at the end for some exercise examples. You guys are always welcome to refer back to this recording to go over some exercises after you talk to your primary care physician. So again, this is Think First to Prevent Falls, program of the Think First National Injury Prevention Foundation. They have a lot of great materials, programs for kids, teen drivers. I strongly encourage you all to check out the website for some great resources. 2 weeks ago, I had also sent out some handouts that go with this presentation. So if you have the opportunity to look at those. And this is me, again, Injury Prevention Coordinator at BI. And so the purpose is to raise awareness of the prevalence of falls and their consequences. We know that that's the purpose of Debbie's program as well. And we want to increase our knowledge on reducing your risk for falls. And of course, again, we suggest that you consult with your doctor or medical provider before participating in exercise. So please, please, please do that before starting any exercise programs. So just a review of the brain, right? So our brain does a ton of different things. So we have our frontal lobe, which controls our decision-making, our emotional control, problem solving, organizing memory. If we go from left to right, we have our parietal lobe. So our sensory information, our touch, sensation, pain. So that's very, very important when we think about our feet, right? We need to be able to feel the grounds that we're walking on, especially when it comes to falls prevention. If you have other health issues, maybe like diabetes, you could have diabetic neuropathy in your feet and maybe get that pins and needles sensation. So it's just really important to be aware of your surroundings. And that's what you would use your occipital lobe for. So that visual information to perceive shapes and colors and your depth perception. And then moving down below, we have the cerebellum, which controls balance and movement, so your coordination. Moving on to your brain stem, that controls your breathing, your heart rate, blood pressure, swallowing, all of these super vital functions to being able to live. And of course, we have our temporal lobe. So that's your hearing, speech, and memory. So your brain is super important. It does a lot of different things. Again, what is a traumatic brain injury? An injury to the brain caused by a blow to the head or body. And as you can see in that second picture with the three heads, you do not necessarily have to hit your head to have a traumatic brain injury. This could be very much the motion that you get in a car crash, right? Where your body's propelled forward, but it's stopped by a seatbelt. And then you can see the causes of traumatic brain injury. And the number one is falls, right? That's almost half of all of the traumatic brain injuries are falls. So that's pretty significant. So if we can help you reduce your risk of falling, then we're doing our job right. Signs and symptoms, please be aware if you have any headache or head pressure, nausea, vomiting, blurred vision, dizziness, sensitivity to light or sound, if you feel groggy or sluggish more than usual, if you just don't feel right. These are kind of your red flags to tell someone, whether it be a call to your primary care, a call to a family member or a neighbor, whoever's available. And then if you really don't feel right, then for sure call 911 or go to an urgent care center or an emergency department. So as I said, please tell someone. Head injuries are not something to be taken lightly. As we went over, the brain does a lot of important things. So we really need to make sure that if you did hit your head, to make sure that there wasn't any damage done. So some long-term consequences of concussions, you can have memory loss or impaired judgment, difficulty concentrating, headaches, fatigue, a loss of balance. And this is for both concussions that are treated and those that are untreated too. So it's really important to go to an emergency room and get the proper scans and tests that you need, just to be able to mitigate some of these consequences. And talk to your doctor, because they will make recommendations based on your individual situation. And that could include having to change your routine in order to promote healing. A lot of times that means not looking at screens. So you might have to limit your TV time or your computer time. So again, falls, more than 1/3 of people fall each year. And 2/3 of those who fall will do so within 6 months, which is a lot. So if you have fallen, just know that you are at a higher risk to fall again. And so that's really empowering to know that we can make changes in those 6 months to make sure that you don't fall again. And falls are preventable. They are not an inevitable part of growing older. So we went over some vision impairments, unsafe home environments, medication regimens, and lack of muscle strength. So that's what we're going to talk about today, is the lack of muscle strength. There's this fancy word called sarcopenia, which means that as you age, your muscle tone decreases. And that's totally normal. But it's up to us to make sure that our muscles are still active and able to be used in case you fall. So this is the cycle of falling, I think is really important to highlight. So here you have this fear of falling, right? Where this blue arrow is. And so because you're afraid, you might restrict your activity. So that might mean you're not walking around your block as much, you're not going to the grocery store, really anything that just makes you sit around more. And so because you're not using those muscles, that leads to a reduced mobility, right? We've heard of use it or lose it. That's very much what this is. And so because we're not going outside and we're not doing things, maybe we feel isolated because we're scared to go to dinner with a friend, right? Pandemic aside, if you wanted to go out with a friend and see a show or have lunch with someone, we might decide not to do that because we're afraid of falling. We're afraid of going outside. We're afraid if there are stairs or curbs or, if you have to take public transportation. And so we can feel lonely. And that leads to a loss of physical fitness, right? Because of that reduced mobility down at the bottom. Because again, we're using it or losing it with our muscles. So that's why exercise is so important. Again, this is just kind of the same chart, but we talk about a loss of independence. And that is a huge concern with people who are at risk for falling. Because if we're feeling isolated, then we're gonna have people do more things for us, right? Because we're not walking around, we're not using the muscles in our legs to do the activities that we need to do. So that can be as large as, going out to lunch with a friend, or as common as maybe bringing your groceries in. And that can impact your mental health, right? Because of that isolation. And it leads to a diminished quality of life because you start to feel maybe depressed because you're not doing the things that you want to do. So again, we talked briefly about home safety, and really what it comes down to is just making sure that you have good lighting everywhere, getting rid of clutter and tripping hazards, making sure your throw rugs are nailed down or taped down or stuck down, and making sure that you're carrying your phone. So if you have a cell phone, always make sure that it's on your person, make sure it's charged, and then having an emergency response system like Life Alert is also a really good idea. So again, this just goes over the same things that we talked about in the living room. In the kitchen, making sure that things are within reach, only using a step stool with a handle. Please don't climb on chairs. They say not to carry pots of water because that doesn't leave your hands free, which I know can be difficult if we need to carry a pot of water from here to there. But when you do, just try to be careful and use non-slip mats. In the bathroom, same thing, making sure that you have grab bars for the shower and toilet, using modifications if you need them, so a raised toilet seat, the handheld shower, or a shower seat. Bedroom, make sure that things are well lit. Wear closed back slippers if you wear slippers, or the socks that have the little grippies on the bottom. Declutter your walkways. Carry your phone at night too if you need to use the restroom. A lot of people will just keep it on their nightstand to charge. And then when you have to get up in the middle of the night, go ahead and unplug it and take it with you. Stairs, again, just make sure that you don't have any clutter on them. Try to have lighting. Keep both hands free. Carry your phone, wear shoes with backs, and just be really conscious of where the stairs are. That way you don't miss a step. Hallways, same thing. Get rid of clutter, remove those throw rugs or make sure they're taped down, make sure everything is well lit. We talked about safety outside the homes. So ramps are great, using handrails. Try to avoid stairs if possible. So if there are ramps or anything like that, and wear sturdy shoes at all times. So we don't want you out and wearing flip-flops or sandals or anything like that. We know that they can be comfortable in the summer, but they're really just not safe. And always carry your phone. Try to look ahead so you're looking up and out at your surroundings instead of down at our feet. It's good to know where our feet are going, but we also need to make sure that we know the terrain ahead of us. So always use crosswalks. If you're out at night, cross away from parked cars. Add a little extra time if you think you are going to be unable to cross the sidewalk before that little hand lights up red. Again, this is the same idea. Always, always, always use your assistive device if you have one. So that would be your canes, your walkers, that sort of thing. Always use those when you're out and about and inside your house as well. They were prescribed to you for a reason. We talked about the importance of talking with your doctor, right? They need a full understanding of you and your situation and your needs. And that's going to help you keep your independence because doctors can treat issues before it's, quote unquote, too late. So we want to be able to kind of nip problems in the bud as they come up. We don't want it to kind of snowball into something bigger. Again, look at those handouts. Here are some examples for conversations to have with your doctor. I almost fell a few days ago and now I'm scared that I will fall and break my hip. Right? So really being able to communicate your concerns with your doctor. Making a list before you go. Knowing your medications and their side effects. Keep your doctor in the loop. Every concern is important and yearly follow-ups is the key, right? So that's your communication is key. Bringing someone with you is going to be a very, very helpful tool because sometimes when we have someone that we trust with us, they can help to translate some of the material that we might not understand. Sometimes when I go to a doctor's appointment, it can be really overwhelming because they give me a lot of information at once. And then I go home and I kind of have to figure out, wait, what did they say? So if you make a list or take notes or have someone take notes for you, you don't have to worry about that. Again, medications, do not stop or start taking medications without talking to your doctor first. This is just to tell you about some categories of medications to be more aware of. So blood pressure, anxiety pills, water pills, antidepressants, laxatives, pain pills, and blood thinners. If you are on any of these right now, do not change anything you're doing unless you talk to your doctor. These are just things that you need to ask extra questions about. Sit before you stand, right? Just slow down, steady yourself, make sure you're drinking plenty of water, especially if you're on any water pills, because you're constantly flushing out your system. So it's important to rehydrate yourself. Make sure you exercise or walk, because again, use it or lose it with your muscles. And even a minor fall can be serious if you're on a blood thinner. So if you fall, call 911 or your emergency contact, or hit that button on your life alert, because blood thinners can lead to more bleeding, more bruising, and there are more risks involved. But again, talk to your doctor before you change anything with your medications. Do not walk if you're dizzy or lightheaded. I know it can be difficult if you need to use the restroom or something like that, but it can be really detrimental if you were to fall. It's also really important to keep track of any over-the-counter drugs that you're taking. So those are the drugs or vitamins or supplements that you would get at CVS or the pharmacy, or any herbs or teas that you're drinking. So keep a list and check labels. Take prescription medications as ordered, learn about your side effects, and ask your doctor if there are any interactions you should be aware of. Here's a great list of things to do at your pharmacy. Asking about side effects, who to call if something doesn't feel right, asking the name of your medication, because sometimes you could be prescribed a name brand, but your insurance will fill the generic. So knowing the difference between the two is going to be important, because they're the same medication. They have the same active ingredient, but they're just called something different, and they might look different too. So knowing what it treats, why you're on it, if there are any interactions, how long you need it. Some medications will only be for a month. If you had an infection and you're on antibiotics, chances are you're not going to be on those for a long time. You're only going to be on them for a short time. But it's important to take them as needed, right? As your doctor says to take them. So read the label, make sure that you finish out that prescription, and ask about missing doses. So if you forgot to take a medication in the morning, is it okay to take it later on in the afternoon when you remember? Or is it a medication that you should wait until the next day? So ask about those things.
What are some 3 key points that you want us to take away from your presentation today?
Absolutely. So here we go. Exercise. These are the important things that exercise will do for you. It'll increase your coordination, flexibility, balance, your sensory input. And again, always consult your primary care physician. Here are some examples. You have deep breathing, making sure that you're sitting up with good posture. This is great to center your mind and get your body ready for exercise. Doing some gentle shoulder rolls is great. And this exercise will get easier. Sometimes it feels really tight, but you can, as you stretch those muscles out, it does get easier. Arm circles, bicycles for your legs, and these are all seated exercises that you can do at home, but be aware of what kind of chairs you're using, right? So you want a sturdy chair like this, with arms or without arms is totally fine, but it cannot have wheels.
Right.
Hands and wrists, you can do these while you're watching TV. Super great. You just make a fist and then extend your fingers out wide. Back and spine, so leaning your torso to one side and the other. And again, some leg lifts. So I want to show you, before we go, about some resources as to where to find these.
Yeah.
So,
and while Katie is doing that, I just want to remind people, because it's icy and cold out there and snowy, doing any one or many types of strength-based or any type of warm-up exercises before you go outdoors is going to be very helpful to help prevent you from feeling like you're stiff walking on the ice. You want to be able to be limber and allow your body to be warmed up.
Yes, exactly. So here are some great videos. You can just Google YouTube and then search go the number 4 and then life. And this is a great exercise program they have for older adults. And then the other one that I have pulled up is 3 balance exercises. So both of them are Go for Life from the National Institute on Aging. And I definitely recommend you check those out. Thank you for having me. And please check out those resources and feel free to email me with any questions.
I just want to really thank you so much, Katie, for sharing with us this information on Think First. I mean, we can't hear it more than once. It's just the more we're reminded, especially when it's cold outside and icy outside, the better.